This is Average Joe PT, where we're here to reduce anxiety, improve function, master your pain. Isn't that right, Scully?
We're going to work on that hip pain.
That's right. Now we're going to change it up a little bit. We're going to start a series here on Average Joe PT, and we're going to start with good old-fashioned snapping hip syndrome. Now, if you're new to this channel, we'd love to have you subscribe down below, hit the bell. We bring content once or twice a week. We do lives all over the place on this channel. So, if you like what you see, we'd love to have you hit the bell down below. Now, like I said earlier, we're going to start doing this as a series, and we're going to start by understanding what the heck is snapping hip syndrome. And over the next 3 to 4 weeks, we're going to go over all types of treatment techniques, surgical techniques, and different types of things that you can do at home to alleviate the snapping hip syndrome. So let's go ahead and get started right now. Well, this is Dr. So-and-so. And like always, this is a figment of your imagination, the snapping hip problem. Not really a hip problem at all. I think all you have is just a little irritation. Everybody has this problem. There's no issues with this at all. I don't understand why people think they need to come to my office and bother me with this particular problem. Snapping hip. Never heard such craziness. Who would think that your hip doesn't snap? Who comes up with these crazy lies anyways? Well, this is Dr. Cool Cats, and I'm telling you, like always, that guy is an absolute moron. He doesn't listen at all, Dr. Know-It-All. You keep following that guy, you're going to be going down a one-way street with no exit on it. Dangerous. Yes, there's a thing called snapping hip syndrome. There's 3 main kinds of snapping hip syndrome. We're going to go over all kinds of stuff here on Average Joe. So you got to keep listening to Dr. Cool Cats here and stick around. Scully, what do you think about those 2 crazy docs, huh?
They are just plain crazy.
Yeah, they continue to be crazy, don't they? The reality is this. Yes, there are 3 different kinds or syndromes of a snapping hip that we're going to go over here. And we're also going to do this as a series. And so we're going to go through a nice video series of snapping hip syndrome and different types of treatment techniques that you can do at home, different types of treatment techniques you're going to do at a physical therapy clinic, as well as some surgical techniques that might need to be done to fix your hip pain or snapping hip syndrome. So let's go ahead and stick around. Here we go. Hey Scully, should we go ahead and get started here or what?
Let's show these people what we're talking about.
That's right. Let's start with there's 3 types of snapping hip syndrome. Number 1, let's just represent this is the muscle group, the iliopsoas. Comes all the way down here. Now we have this thing on the inside here called this pectineus eminence. All right, on this little spot right in here. Oh boy. Now that tendon now can come down and snap right across that little groove in there. I'm going to show you a little blow up right there, what I'm talking about. See that? As well as it could snap against the femoral head. The head of that femur right there, as you bring your knee up towards you, you can go ahead and snap that iliopsoas tendon against that femoral head that I'm showing right here. So that's an internal snapping hip syndrome, and that's syndrome number 1 for this particular problem. Isn't that right, Scully?
1 down and 2 to go.
That's right. Number 1. Now number 2, hold on, stay right there. All right, Scully, what's number 2?
External snapping hip.
That's right, external snapping hip syndrome. Representing the IT band or iliotibial band. Let's go back. Where's the head? Oh no. Let's get that head of that femur, right, boys and girls? And so, if we look at where the IT band comes from, it attaches at the top of the hip here, at the iliac crest, and runs all the way down, and attaches to the outside of your tibia or your knee joint. And so if we think about that, let's go ahead. That band comes all the way down and attaches right there on the side of the tibia, just past the knee joint. And that can snap way up high here at the what we call the greater trochanter that I'm going to show right here, blown right up on you, where that tendon, that IT band, iliotibial band, can snap over this greater trochanter of your femur, and that is the second way that you can have snapping hip syndrome. Hey Scully, do you know the third type or third classification of this hip problem?
Cartilage and labral injury.
That's right. You know, Scully, he's pretty smart. Yeah.
Smarter than you.
Okay, don't get a fat head now. Yeah, you know some stuff. Boy, he's ridiculous sometimes, people. If you had to live with him, you'd lose your hair like I am too. That's right. The third one is labrum. If you have a tear in your labrum. What the heck is the labrum of the hip? It is basically the outer rim tissue or cartilage of the socket of the ball and hip. And I'm going to show a little pic up here talking about that labrum and what it looks like. That's right. If you have a small tear, it might feel deep in that hip. And the reality is that tear in there can snap, representing the tear with this nice green band here. If you have a tear inside there, and it can snap as that ball rotates over the socket. And next thing you know, it's snapping deep in there, giving you really deep pain. So yes, that is the third and final type of snapping hip you can have with a snapping hip syndrome. Scully and I would love to have you guys hit this next content right up here. If you guys are new to the channel, we'd love to have you subscribe down below, hit the bell. We bring content once or twice a week. This is our first video in our series of snapping hip syndrome. So if we got some more of those out there, I want you guys to go ahead and look at the next one. It's going to go over all types of treatment techniques and further discussion in regards to snapping hip syndrome, isn't it, Scully?
What are you waiting for? Click on the next one already.
That's right. And so, if this is your first time, hit the bell. And like Scully and I always say, we want you to look up and keep smiling. See you next time, folks.